Dear Saathi community, as you all know, you have given us a lot of questions about periods, period cramps, clotting, and a lot of things which you are worried about. And we promised you that we'll come with a gynecologist and talk to her about all the problems you face, and she'll help you solve all your problems. So we are here with Dr. Parul Sharda, who's a gynecologist and has 15 years of experience and is practicing in Ahmedabad. She has a area of interest towards awareing young girls about women health and hygiene, menstruation, and all the problems related to it. So, welcome, Dr. Parul.
Thank you.
So, would you like to share something to Saathi community about yourself or about a little tip or advice which you want to start with?
So, like you've already introduced, I'm a gynecologist. I'm practicing in Ahmedabad. My area of interest is infertility, but still, because I have two beautiful daughters, I like talking to young girls, making them aware that menstruation is a normal phenomena. It is nothing to be scared of. Because I feel as a doctor and as a woman, it's my service and my duty to the community to give it back to the community.
Wow. So, what is the basic problem which I have heard and a lot of people have shared is about the duration of their menstrual cycle and as well as the flow. So, one of the biggest thing which we have heard is that is my periods come for 2 days to 7 days. These are the questions which we have heard. Majorly, people have shared that their periods are for 3 to 4 days. So, is it normal to have a cycle of 3 to 4 days?
Yeah, it's pretty normal. I mean, actually, both the durations that you are talking about, both are normal durations. Like, if a girl is having periods for 1 day or for 7 days, both the figures are correct. Like, both can be taken as normal. One is the lower side of the normal and one is the upper side of the normal. And 3 to 4 days is the average duration for which maximum number of women will have their periods. But both the durations can be taken as normal durations.
And one other thing which women are really concerned about is the flow. Like, people have really heavy periods, and few girls face very light periods. So, is it normal to have different kind of flows during their periods?
See, scientifically, if we talk, then in an average, a woman should bleed around 40 ml of blood during the entire duration of her periods. And 80 ml, around 80 ml is taken as the upper limit, above which we call it as heavy periods. Now, scientifically, in a layman's term, there is no way in which a woman can measure whether she's having heavy periods or less periods.
Right.
Females who are very concerned about their hygiene frequently keep on changing pads and feel that they are having a heavy flow.
Right.
And there are other women who will not change their pad, use the pad for entire day because of whatever reasons, economic reasons, hygiene reasons, and say that they are having normal periods. So it's very difficult, but on an average, if you have to explain to a young girl, you can tell her that if every hour you are changing the pad and that is happening frequently, then you are having heavy periods. If you don't need to change the pad that frequently, then mostly whatever flow you are having is normal flow.
Okay. One of the questions I have received is she had her period after 13 days. Like last cycle and this cycle had a 13 days difference. So is it normal?
See, if it happens once in a blue moon, like once in a year, a female undergoes this phenomena where she has early periods or delayed periods, then it is pretty normal because there are going to be seasonal variations. The day and night when they change, then it is going to affect your periods. There are going to be natural influences. Also, there are other influences, whether you are undergoing some stress or you have lost weight, gained weight. I mean, there is a long list. So, if this is once in a blue moon happening, then it is considered to be a normal thing. But if it is happening again and again, like every 13 days, you are having your full duration of periods. Like you are bleeding for 3-4 days, then you are stopping, then again after 13 days, you are having a full flow. Then you do need to consult a gynecologist because this is not normal.
Okay, so like if this is happening regularly, this is not normal. At least the cycle should be
because
of
then
28
there is
days.
going to be blood loss and there is going to be decrease in the hemoglobin concentration, which is known as anemia, and that is going to affect the health of the woman.
Okay.
That is.
And stress has a reason related to abnormal
Yes,
periods.
definitely. Stress has a direct effect on the periods of the woman.
Okay, so like if somebody is undergoing stress, that is going to affect anybody's menstrual cycle.
Yes.
Okay. One of the questions I've received is how to stop mid-cycle spotting.
Yeah.
So she shares that during her ovulation she bleeds. So is it normal? If yes, why? And if no, how she can stop it?
So mid-cycle bleeding is again a very normal phenomena where the female ovulates in the mid-cycle. If the female is having a normal cycle of let's say 28 to 30 days, so on 14th or 15th day she will see some slight spotting, slight abdominal pain, and there is going to be slight staining of the panty or the panty liner if the woman is using. So that is very normal. Rather, it is a very good indication that the female is ovulating normally, she is fertile, and whenever she is ready, she can have babies, and she can actually use this time to target her fertility. So there is no reason, absolutely no reason to stop this kind of bleeding, because this kind of bleeding is self-limiting, generally stops within a day. And in case it is really heavy and it is really mentally harassing somebody, then hormonal treatment is required. Like you have to take oral contraceptive pills or cyclical hormones, which I really don't advise, because it is a natural physiological thing. So it should not be deferred or it should not be avoided.
Okay. Another one big problem which women face is about spotting and clotting during periods.
Yeah.
And that is one of the biggest concern of them, that why it is happening, is it normal?
Yeah.
So why is there a presence of clots during periods? What is the reason behind that?
See, clots can be both normal and abnormal. What happens is when you are bleeding, there are going to be, it is just not blood. There are other components also, like there are mucus, there are tissue remnants, tissue fragments, which again they club together to form a clot. So for the first 2 to 3 days, if you are having some small clots passing here and there, which are dark brown in color, then you don't need to worry, because it is a good indication that you are bleeding normally and the blood is clotting normally, and so clots are forming. Clots generally form in the vagina. When the blood comes out of the uterus, it is in liquid form, then it accumulates in the vagina and clots are formed. But yes, even after 2 to 3 days of your periods, you are having big clots which are fresh red in color and they're really big in size, then that can be a cause of concern. That means that you are bleeding heavily and you might need to see a gynecologist.
One other serious concern which I have received is herpes infection during periods. So, Dr. Parul, what is it and how it can be treated?
So again, herpes is caused by herpes simplex virus type 2, which is the genital herpes. Like a lot of people experience some sores, kind of blister formation around their lips during fever, which is herpes simplex 1. So similar things happens when it happens in the genital area. It is known as herpes simplex virus 2 infection, and in common term we call it herpes infection. So periods don't make you more prone to catch the infection. They don't. If you are maintaining your hygiene, if you are washing regularly, changing your pads regularly, then let me tell you, you are very safe. But any virus, it will stay in your body forever. And during periods when you have hormonal changes, these viruses can get activated again, and you can have herpes virus activated during your periods, causing small sores or blister formation on your genital areas. So menstruation don't increase your chances of getting a fresh herpes infection, but yes, an old herpes infection can get reactivated during your periods.
And this is something which needs urgent doctor attention?
No, you just need to maintain your hygiene. If it is painful, you can take a painkiller. You just need to wash, keep on changing your pads. Generally, it is a self-limiting infection. It will generally subside within 2 to 3 days. If you feel that the problem is really aggravating, it is very painful, you can't even sit, the sores are, like there is a lot of discharge from the sores, then yes, you can consult your gynecologist.
The third big topic of our Saathi community is one of my topic as well, which is PMS and cramps. Like, it's been years now, even I have been facing it, and really I have a lot of questions regarding it. So, why does cramps happen during periods, and what is the right way to deal with it?
So basically what happens is that if you understand the female's physiology, so her body is actually preparing. There are cyclical hormonal changes which are happening in her body. Like one half of the period one hormone is rising, then the other hormone is rising. And when the body receives that signal that she's not pregnant, she starts bleeding. That is the basic, in simplest form, if I make you understand what periods are. So the hormones which are released in the second half of the cycle, actually they cause the PMS. So PMS can be something like really mild, where you are having some headache or some nausea or indigestion problems, and it can be really severe. Let us say it's a huge spectrum where you have fatigue, you have leg cramps, you have lower abdominal pain, some people start having acne, some start having blisters in their mouth, some have diarrhea, vomiting, and the severest form is severe mood swings, when you just don't want to do anything. So it can be a whole spectrum. And general problem with the today's generation is the diet. It is a salt heavy diet. A lot of women these days are taking liquor also. They're exercising less. They are actually considering this to be a disease and sitting at home, oh, I have got PMS and all that. So that is where the approach is wrong. What you need to do is that if you have PMS, you need to change your diet. You need to stop eating salt. Like, let us say if you experience PMS 6 to 7 days before your menstrual cycle, then you stop eating salt 10 days before your menstrual cycle, which means that you have to stop taking junk, you have to stop eating chips, you have to stop taking sodas, caffeine, alcohol. So this can help you, because the main pathology of PMS is water retention. And when you make these dietary modifications, when you switch on your diet from a junk heavy refined food diet to a diet which is more natural, like fruits, vegetables, our Indian diet, then most of this problem is tackled. Most of this problem. Avoid late nights, avoid caffeine heavy food. Like, a lot of people will take colas and think, oh, it's just a cola, but actually you are taking a lot of caffeine, which is then aggravating your PMS. If the case is very severe, then we like to investigate the patient. We do a couple of tests, because at times these women are deficient in calcium, vitamin D, B complex. So first we try to treat these nutritional deficiencies and try to see if the female is responding. A lot of young women will respond to a simple B complex tablet. Simple B complex. The moment you understand that whatever is happening to your body is normal, you start taking it normally. If you feel that, oh, I am suffering, then that is where the psychological elements will come into play. If it's very, very severe and it's hampering you, it's causing severe mood swings, then we also use hormonal contraceptives. We try and change the hormone concentration in the body and give relief to the woman. Second thing I would like to add, that exercises really help, because whenever you're doing any kind of exercise, either it can be aerobics, it can be walking, it can be brisk walking, it can be swimming, it can be something as simple as dancing. You are releasing those endorphins, those happy hormones in your body, which will again help you fight PMS.
And PMS and cramps are interrelated?
It is not necessary, because cramping is another phenomena. Cramping is that your uterus is trying to throw that blood outside your body, which is going to cause the abdominal cramps. The leg muscle cramps are generally due to the hormonal changes. It is most commonly seen with females who are having some potassium or magnesium deficiencies, because deficiencies in this age are very common, where most of the youngsters are just eating junk food all the time. So these deficiencies have to be tackled. Also, a simple antispasmodic tablet can be taken, like over the counter you get cyclopam, that can be taken to handle your spasms.
And that was my next thing which I was coming to, diet and exercises
Yeah.
during menstruation. So, like, like you have shared what kind of food we should eat during our menstruation. What is the exercises? What are the exercises you would suggest our community to do during the menstruation?
If you put it in one simple line, then it is just keep moving. When you have your periods, don't be confined. The best exercise is any form of aerobic exercise. It can be just one simple walk which you take around the garden. It can be brisk walking. It can be a simple aerobic exercise which you do. If you are using a tampon, you are comfortable. You can even do swimming in your periods. It's not a problem. If you are somebody who is exercise phobic, you can just switch on the music and start dancing. And also there are certain postures in yoga, like there is the cow posture, there is the cat posture, cobra posture, which you can try. This will help you relieve the cramps also, and this is also going to regulate the flow. Because any kind of exercise, any kind of happy activity you do is ultimately going to release endorphins, and endorphins are naturally said to reduce the perception of pain in human body.
Okay, and what are the hygiene and disposal practices like a woman should follow during their periods? Because there are a lot of concerns around what kind of hygiene one should manage,
Yeah.
and there are a lot of myths around that you don't take bath during menstruation, you don't wash your hair during menstruation. So, what are the hygiene practices a women need to follow during menstruation?
So in the modern day, just go on about your life like you usually do. Take your bath. If you are supposed to wash your hair on that particular day, wash your hair. Change your pads frequently. I advise my patients to change pad every 4 hours if it is feasible, because that is the main area of concern where Indian women don't change their pads frequently. You can even try and take a bath 2 times, but that is not necessary if you are not doing it in your routine practice. And there are certain washes like you can wash your lower area with certain lactic acid washes which are easily available over the counter. They will also prevent outbreak of infections during the time of periods.
Okay, and is there rashes and foul odors during periods? Like, what can be done for that?
Only if you are not maintaining the hygiene.
That's the only
Yeah,
reason
if you
why.
are bleeding normally, you are maintaining your hygiene, you are regularly changing your pads, you are using a good quality pad, you are washing your perineal area frequently, then I don't see the problem of odor coming. If you have troublesome odor that is really bothering you, then I think you need to visit the gynecologist.
Okay, and what is the best practice one should follow to dispose a sanitary napkin or any
Cover your
tampon?
sanitary napkin with a newspaper and throw it in a dustbin. That is the only practice to follow. That is the only way to dispose a sanitary napkin.
Any last minute thoughts or advice you want to give to the women out there from the millennials and Gen Z age?
Just be happy that you are having periods. This means that you are normal. You are a normal woman who would one day get married and have kids. And be happy, take it naturally. And if you have any problems, approach it scientifically. That's all I would like to say.
Thank you so much, Dr.
Thank
Parul.
you.